Good day, everyone. I'm Ms. Aisel Peñalosa, a grade 9 science teacher, and for today, we're going to discuss about the prevention of the diseases of the respiratory and circulatory system. You have learned on the previous lesson that the respiratory and circulatory system work together to transport materials all throughout the body. But what if these systems fail to function properly? We often see cigarette labels having images like what are shown. Are you familiar with these diseases? We will answer the questions: what is the main cause of these diseases, and how can we prevent these diseases from happening? This lesson will focus on Quarter 1, MELP 2, infer how one's lifestyle can affect the functioning of the respiratory and circulatory systems. With the following objectives: identify and describe some diseases that affect the respiratory and circulatory system. Explain how one's lifestyle can affect the functioning of respiratory and circulatory system. And finally, appreciate the importance of having a healthy lifestyle. We will start with the diseases that affects the respiratory system. Asthma is a chronic illness in which the bronchioles, the tiny branches into which the bronchi are divided, become inflamed and narrow. People with asthma have difficulty breathing, the chest feels tight, and they wheeze. Asthma can be caused by several things like allergies, cold air, warm air, moist air, exercise, or stress. Asthma can be controlled by taking medication and by avoiding contact with environmental triggers for asthma, like smoking. Bronchitis is an inflammation of the bronchi, the air passage that conduct air into the lungs. Acute bronchitis is usually caused by viruses or bacteria and may last several days or weeks. It is characterized by a cough that produces phlegm and mucus. Symptoms include shortness of breath and wheezing. Acute bronchitis is usually treated with antibiotics. Emphysema is a chronic lung disease caused by the breakdown of the lung tissue. Symptoms of emphysema include shortness of breath, especially during exercise, and chronic cough, usually due to cigarette smoking, and wheezing, especially during expiration. Damage to the alveoli is not curable. Smoking is the leading cause of emphysema. Pneumonia is an illness that occurs when the alveoli, the tiny air sacs in the lungs where gas exchange takes place, become inflamed and filled with fluid. Pneumonia can be caused by many things, such as infection by bacteria, viruses, fungi, or parasites. Symptoms of pneumonia include cough, chest pain, fever, and difficulty in breathing. Treatment depends on the cause of the pneumonia. Lung cancer is a disease in which the cells found in the lungs grow out of control. The growing mass of cells can form a tumor that pushes into nearby tissues. It is the most common cause of cancer-related death in men and the second most common in women. The most common symptoms are shortness of breath, coughing up blood, and weight loss. The most common cause of lung cancer is exposure to tobacco smoke. Lastly, tuberculosis or TB. It is a common and often deadly disease caused by a genus of bacterium called Mycobacterium. Tuberculosis most commonly attacks the lungs but can also affect other parts of the body. TB is a chronic disease, but most people who become infected do not develop the full disease. Symptoms include a cough, which usually contains mucus, and coughing up blood. Let's have a short concept recap. The diseases of the respiratory system are asthma, bronchitis, pneumonia, emphysema, lung cancer, and tuberculosis. Let's now discuss the diseases that affects the circulatory system. Atherosclerosis is a hardening of the arteries. It is typically caused by a diet high in fat. which leaves fatty deposits on the lining of the blood vessels. These fatty deposits stick together and make the arteries hard and less flexible. Atherosclerosis leads to high blood pressure, which can damage the heart and kidneys and even lead to strokes. Heart attack occurs when not enough blood reaches your heart. This can happen due to artery blockage. Heart attacks damage the heart muscle and are medical emergencies. Symptoms are pain in the center or left side of the chest that feels like mild or severe discomfort, pressure, fullness, or squeezing, pain that radiates from the jaw, shoulder, arm, or across the back, shortness of breath, sweating, nausea, irregular heartbeat, and unconsciousness. Blood pressure is the measurement of how much force is used to pump the blood through your arteries. If you have high blood pressure, also called hypertension, it means the force is higher than it should be. High blood pressure can damage your heart and lead to heart disease, stroke, or kidney disease. There are no symptoms with high blood pressure, which is why it's often called the silent killer. Lastly, abdominal aortic aneurysm is a bulge in a weakened part of the aorta. The aorta is the largest blood vessel in your body. Abdominal aortic aneurysm can stay small and never cause problems, in which case your doctor may take a wait-and-watch approach. When it becomes larger, you may experience pain in the abdomen or back. Large and rapidly growing abdominal aortic aneurysms are at greatest risk of rupturing. This requires immediate attention. Concept recap. These are the diseases of the circulatory system: atherosclerosis, heart attack, hypertension, and abdominal aortic aneurysm. After knowing the different diseases that affect the respiratory and circulatory system, what do you think are the most common causes of these diseases? Yes, you're right. They all fall to one reason: unhealthy lifestyle. Let's define what is unhealthy lifestyle. It is defined as a lifestyle where a person engages in activities that are detrimental to health. Anything that you do that has negative effects to your health fall in this category. Take a look at the pictures. Let's cross out all the images that show unhealthy lifestyle. Sleeping late, eating junk foods, smoking, and drinking alcohol. These examples are the major causes of the respiratory and circulatory system diseases. But how can we prevent these diseases from happening? Here are the 10 healthy lifestyle goals you can follow. Get adequate rest daily, get regular physical activity, eat more plant-based foods, eat more whole grain foods, choose healthy fat. Achieve and maintain a healthy weight, be free of dependence on tobacco, illicit drugs, or alcohol. Maintain a cheerful, hopeful outlook in life, spend quality time with family and friends, take time daily for spiritual renewal. Now, reflect on yourself. Are you doing the right thing? Thank you for watching. I hope you learned something from this video.